If you're feeling exhausted all the time, your labs are normal, and you have been told that it's just stress, hormones, or part of being a mom, this video is for you. Hi, I am Athena Newell. I am a family nurse practitioner at Stat Wellness in Charleston, and I work in functional medicine. Today, we are talking all about autoimmune disease in women because it is wildly common, frequently missed, and oftentimes dismissed. And I want you to know if something feels off in your body and you've been told that it's all in your head or your labs are normal, it might not be. So why does this matter? Autoimmune disease affects millions of Americans, and women make up about 80% of those cases. Yet on average, it takes years for women to get a diagnosis. That is years of feeling exhausted, having joint pain, brain fog, feeling inflamed, and being told that their labs are normal or they're fine. And what I see in clinical practice is sometimes women actually start to think that maybe it is in their head, but I don't think so. What might be happening is that their immune system is dysregulated, and traditional medicine often doesn't catch it early, and they're not looking deep enough. What is autoimmune disease? Let's break it down simply. Your immune system's job is to protect you from bacteria, viruses, and other threats. In autoimmune disease, the immune system is misfiring. It's mistaking your own tissue as a threat and starting to attack it. Your body can start to attack your thyroid, joints, skin, gut, nervous system, your pancreas. And here's the key. Autoimmune disease isn't just one condition. There are hundreds of autoimmune diseases. Symptoms can look very different from person to person, which is part of why it gets missed. Let's talk about what women are actually experiencing. Some of the most common symptoms I hear in practice are chronic fatigue despite adequate sleep, muscle and joint pain, brain fog and trouble concentrating, hair loss, skin rashes, numbness and tingling, weight gain, or unexplained weight loss. And here's the kicker. None of these symptoms scream autoimmune disease on their own. So instead, women get told it's stress, it's your hormones, you're just busy, or this is a normal part of aging. But persistent dysfunction is not normal. So why is this disproportionately affecting women? Women's immune systems are more reactive by design, which is great for fighting infections, but it's also increasing our risk of autoimmune disease. On top of that, add hormonal shifts like perimenopause and menopause, pregnancy and postpartum, chronic stress, poor sleep, nutrient depletion, and you've got yourself a perfect storm. I see this a lot in moms. They say, my kids are sleeping, I'm sleeping, why am I still exhausted? So the problem is probably not sleep itself. It might be your immune system or an inflammatory problem. Now, autoimmune disease does come with a genetic component, but it's not usually one gene that's flipped on. It's usually a combination of an inherited genetic predisposition and then something that triggers the immune system. Common symptoms include chronic stress or a traumatic event, infections, gut imbalance, food sensitivities, environmental exposure, or hormonal shifts. So think about genetics as the light switch and your environment or a trigger turning the light switch on. So how does functional medicine approach autoimmune disease differently? In conventional medicine, autoimmune disease is usually treated with anti-inflammatories, steroids, or immune suppressants. And sometimes those are absolutely necessary, but they don't answer the question, why did the immune system become dysregulated in the first place? In functional medicine, we look at inflammatory patterns, gut health and nutrient deficiencies, hormonal balance, stress physiology, and immune markers. Sometimes we'll draw labs that are a bit broad, and sometimes we'll use more targeted autoimmune testing. But the goal isn't just symptom suppression, it's root cause understanding and long-term support. If you take nothing else from this video, let it be this. If your symptoms are persistent, progressive, and impacting your quality of life, you deserve more than reassurance and being told that everything is normal. You deserve curiosity, you deserve a provider who listens, and you deserve a plan that makes sense for you. So if this resonates with you, give it a like, subscribe, or share this with someone who's being told that everything's fine when they clearly don't feel fine. And if you want to explore what a root cause approach looks like for you, you can schedule a free 15-minute consult with me at Stat Wellness in Charleston. Thanks for coming.